Hey guys, welcome back to Medical Coding with Blue. Today's episode is all about why I recommend the Ahima online medical coding training program. If you're brand new to my channel, welcome. I am Blue, I'm a medical coder. Okay guys, I get asked all the time, Blue, what do you recommend for online training programs? What school do you recommend to learn medical coding? I have said it many times, so I'm gonna do this specific video about Ahima. Now, I am a member of Ahima. This is not a sponsored video. They did not pay me to talk about this. And I always tell you guys that I will be very straightforward with you and recommend only the things that I would go through or that I have gone through. Now, the reason that I recommend medical coding training through Ahima is because they are the certifying body themselves. And what better place to learn about medical coding than through the association themselves? Now, they do have a 13-course bundle. You have to reach it by going to the Ahima store. I will be leaving all related links in the description box below, so please make sure that you check out the description box because it never fails. After these shows, somebody always says, Blue, where do I find it? In the description box, that's where you find it. So when you go and you look at this online course bundle, and this is under the Medical Coding and Reimbursement online course bundle. This course bundle is all the courses all together. You get 365 days from the time that you pay, and I'll talk about the cost in here in a minute. You get 365 days from the time that you pay to complete this program, okay, there's 13 courses. Now these 13 courses will prepare you for either the CCA, the Certified Coding Associate, which is the entry-level medical coding credential. This says that you have had no prior experience and that you are brand new to the field, but that you have the competence to code in both inpatient and outpatient medical coding settings. Now, they also prepare you, this bundle will also prepare you for the CCS, which is a Certified Coding Specialist. This is the gold standard of medical coding credentials. This is the credential that 99.999% of employers will ask for because this is the mastery of the inpatient and outpatient setting. This says that you have mastered all of the things about medical coding and that your knowledge is advanced. Now, here's the thing. There are people who are brand new to the field of medical coding, never been in the field of medical at all, and they are still able to pass this. I do have an audience member who just passed his CCS exam, never had any experience in medical coding at all. He went through the online Ahima 13-course bundle, and the thing that he has shared about it is that there are no like live videos. It is a lot of like slide decks and things like that. So the courses all do prepare you, but there was quite a bit of supplemental things that he had to do to prepare himself for this exam. But the foundation is there, learning it through Ahima. Now, the course bundle does cost $2,993.25 if you are not a member of Ahima. Now, that is just the cost of the course. That is not including the cost of the books, which can be purchased separately. And that is roughly another $1,100, okay, on top of that. They just didn't include the cost of the books in the cost of the course. So that is something to know when you are considering going through the 13-course bundle. Now, here's the other thing, too. When you are going through this, you will have all the things that it's going to make it necessary to prepare you for these exams, right? So here it says, let's see. This bundle includes access to 13 online self-paced courses to hone your biomedical knowledge, build your health information management expertise, and apply medical coding concepts. Education to meet the CCA or CCS exam requirements or recommendations, a certificate of completion from Ahima upon successful completion of all 13 courses. Just because you get a certificate of completion does not mean that that's your certification. You actually have to pay to take a certification exam after this, okay? So just keep that in mind. Opportunities to accelerate your educational journey. and save money by applying transfer credits toward a degree program. So if you are interested in pursuing your degree afterward, you will have met some of the requirements already having taken this program through Ahima Online. A one-year Ahima student membership to help build your network and access valuable career resources. Offer only eligible for non-members after purchasing product number, and then it gives the product number, or the medical coding and reimbursement micro-credential. And then Ahima members may be eligible for a discount with participating institutions to continue their education and earn an academic certificate or a degree. Important notes about this program. Individuals who have purchased any coding basics courses starting on January 1, 2018, will be eligible to earn the medical coding and reimbursement micro-credential upon completing all 13 courses. Now, a micro-credential refers to them saying that you've completed a course. It's not something that you carry on your name or anything like that, okay? So just so you guys know, it's like a certificate of completion, basically. You are not required to repurchase this product. Once your purchase is confirmed, you can access all 13 courses for 365 days from the date of purchase. Please be mindful of your educational progress and allow enough time to successfully complete each course in the program. Separate purchases of required textbooks may be needed for some of the courses in this bundle. Review individual product descriptions for details. That's why I say it's another roughly $1,100, okay, for those books, give or take. So the 13 courses include anatomy and physiology, medical terminology, pathophysiology and pharma, healthcare data content and structure, healthcare data systems, reimbursement methodologies, introduction to healthcare technology and information systems, ICD-10-CM for beginners, ICD-10-PCS coding for beginners, medical law and ethics, CPT coding for beginners part 1, CPT coding for beginners part 2, and medical coding practice and career preparation. Now that medical coding practice and career preparation includes 100 practice coding with access to more than 100 realistic exercises and an opportunity to use leading industry technology like the 3M encoder. So you will get access to that when you are working with that portion of the course, which is the medical coding practice and career preparation. You have the opportunity to diversify your experience within a variety of care settings, including hospital inpatient acute care, hospital outpatient and clinic services, physician practice encounters, home health services, and long-term care. So basically what this means is these 100 realistic practices, they're going to be in these 5 different settings: hospital inpatient acute care, hospital outpatient and clinic services, physician practice and encounters, and then home health services, and then long-term care. So it's going to give you a variety of those types of encounters. So that is something that you'll be able to practice with at the end of your program. Course outcomes: upon successful completion of this course, you will be able to apply the guidelines and assign codes in a variety of different healthcare settings, including ICD-10-CM, ICD-10-PCS, and CPT. Develop methods for gathering professional resources to remain current as a coding professional in the healthcare setting. Examine the Ahima standards of ethical coding and the expectations of professional conduct for coding professionals. And then prepare to transition into a career that requires coding knowledge. And then it talks about all your required books and the recommended books and things like that. So you will have to get additional things. That's not just the only cost right there, the $2,993.25. There's also the $1,100, give or take, for the books that you need to purchase in order to get through this course. Now, this course will prepare you, but as I said, there are some supplemental studies that you do have to do, and there are some things that you can do on your own proactively to get more practice. Now, I have always recommended that if you cannot do this, if this is too much money for you, because Ahima does not have scholarships or anything like that, they do not take Pell Grants, they do not do any of those things. So you have to pay for this course. If you cannot afford it, that is okay. I do have the independent study with all of the books and everything that I recommend, and it is literally for free online with on my YouTube channel. So all you have to do is just type in independent study, and there it is. So that's the thing, that you have that alternative. You don't necessarily have to go through an online medical coding program. You can study on your own. However, I will say that it does take a bit of discipline. If you are studying either through the Ahima online program or on your own, it does take you to be proactively setting yourself on a schedule and making sure that you are completing your tasks as you need to. I get a lot of people who write to me and say, well, Blue, I'm just not that disciplined. Well, then maybe you might want to try to work on that, because this is something that is critical to medical coders. You have to be self-sufficient when you are in the real world. Number one, you do have to learn how to do your research. You do have to not always run to your supervisor or run to your lead coder, but you do have to learn how to do your own research on your own. And when you are getting audited, you have to be able to defend yourself as well, and you have to be able to show reputable resources, like from the coding guidelines or from CPT assistant or from coding clinic, and those types of things to kind of help you help support why you selected the codes that you did. That being said, this is a very good program, and 12 months is, or 365 days is the right amount of time to be going through all of these courses. You know, it's basically a little over a course a month, because you have 13 courses here, you have 12 months to do it in. So it's a little over a course a month. And it is doable, guys. It is really doable. If you need a little bit more time on certain courses, it's okay. If you complete your anatomy and physiology program or a course, and you feel like you need more time to study, it is okay to piggyback some of the studying throughout your course, okay? This is completely at your own pace. You do have to complete all of the courses in this bundle in order to get the full effect of what they're trying to teach you, even though it is, there are no live instructors. It is just like slides and things like that, and you're reading from the book and you're going through the program itself. So that is the way that we learn. Unfortunately, medical coders do have to learn a lot on their own, and sometimes this doesn't always prepare medical coders, and especially if they're not in medical coding for the right reasons, which it's all about, for some people it's all about money, and this field does pay very well, but if that's the only thing that's driving you, that's where you're going to miss out on a lot. So if you kind of put that worry aside, because that worry, you don't even have to worry about that. Medical coders get paid well, so don't worry about that. Worry about educating yourself. We have to know what doctors know while never having gone to medical school. We have to be able to understand what they are saying to us when they are documenting everything. And for people who think that anatomy and physiology and pathophysiology is not that important, you're wrong. You are wrong, because how are you supposed to know what codes to look up? And oh, Blue, it's just as easy as looking up the codes in the book, and there's an alphabetical index, and then you can look it up in the tabular section. It's not that easy, especially if you don't understand that if there's a definitive diagnosis, you're not going to pick up symptoms, right? But if they have a sequela, then you are going to pick up the symptoms that are related to that particular injury. So that's the thing that you have to think about. There's different rules for different things. And as you get into this field, you will start to learn these different things. And there's the coding guidelines that I always recommend reading once per week. Now, if you did that for every week, you would really be proficient in those coding guidelines. And it makes a lot of sense after a while. It's not going to make sense to you in the beginning. It will not make sense to you in the beginning. It's going to be like a foreign language, because you are learning a new language. And learning this new language, you're going to have to pace yourself. You're going to have to be patient with yourself. And it is like learning, like when you're in elementary school again. Remember how the teacher always had the border around the top of the room with the numbers and the letters and everything, so that you could see it on a daily basis? It's the same thing with medical coding. you have to put up in your study area, you know, the anatomy posters. Again, in the description box are all of the Amazon affiliate links that I recommend. You do not have to click on those links, guys, because I may get a commission if you do, but the titles are there. So you could just look at the titles and then you could put it into Amazon yourself. So, or wherever you find your study materials at the bookstore or whatever. So get things and hang them up so you can see them. Look online, look at the videos on YouTube. There's a ton of really good channels on YouTube. I used to share my channel recommendations on YouTube. However, I do not anymore because so many people have something to say about the channels that I recommend. But these are the channels that I have felt have helped me. So I do share this information on my Patreon channel. Patreon, if you don't know, is a lot like YouTube, except that you are paying to support the creator with a monthly pledge. Mine, the current lowest level right now is $10 per month, but it gives you access to all of the coding quizzes that I've posted, all of the exercises that I've posted about coding, and as well as crossword puzzles and word finds for medical terminology and anatomy. I try to make things fun when it comes to learning. I am a nerd after all, and I'm very proud of it. And it's okay. It's okay for me. But I do try to be very interactive with my Patreon audience. I post updates on myself personally that I do not share here on YouTube. And I try to do like a once a month. I was doing Jeopardy. I was doing the Jeopardy game once a month. And so my audience on Patreon has requested a study hall. So I do what they ask me. And the first study hall was very successful. And study hall is an hour on a Saturday, the third Saturday of the month, where, you know, I meet with my Patreons on Zoom, and we talk about whatever questions they have, and I clarify those things. So it's nice to kind of have that little bit of change. And sometimes when people are asking questions, other coders can learn from those as well, and it's just something that you can attend if you are interested in that. So that is what I do. It's about being proactive when you're trying to learn on your own, because again, it takes so much discipline, guys, but it's not impossible. And when you are on this journey of learning online and learning independently, it's different. And especially wherever you are in your life, if you are going into a second career, perhaps you've retired and you want to continue to work because you still have all of this energy to work and you want to do something different, and medical coding just seems like a good idea to you, and it is. A lot of people will choose to have their career, and then they get into medical coding, and then they have this other career in medical coding, and they love it. You know, when I went to school, there was a lady, she was age 61. She got her medical coding certification for the first time. She's still a medical coder today. So what does that say? And I've been a medical coder, certified medical coder since 2008. I started off with my CCA. Then last year I put it to bed after many, many years, 13 years. And I got my CCSP, and then I got my CCS. So I am all the way with Ahima. I do recommend AAPC as well if you are out there and you're trying to decide which association to go with. I do recommend AAPC as well, but they have a different format, different structure. I believe in recommending the things that employers are looking for, and they are looking for Ahima and AAPC certified medical coders. So if you choose one or the other, all you need is one, folks. All you need is one. I do recommend to brand new medical coders that you do start with only one certification. This falls on deaf ears a lot, but I will still keep saying it because I had one certification for many years and I did a lot with it. I was not held back from any opportunity or any experience during that time either. So, you know, there's that, you know. But yes, again, all of these courses are important. You may not think that, oh, well, health information technology and information systems, why do I need to know that? You need to know a little bit of everything. And trust me, this course is prepping you for either the CCA or the CCS. And whichever one you decide to go with, this has already laid the groundwork. And there's also a third option. If you find that you do not understand ICD-10 PCS, don't feel alone. I was there, trust me. But if you do not understand ICD-10 PCS, you can always take the CCSP, which is a Certified Coding Specialist Physician-based. This is just the outpatient setting coding, and it only, it covers, of course, diagnosis coding, but it covers HCPCS level 2 coding and CPT coding as well, current procedural terminology. It does not have ICD-10 PCS on it at all. So that is always another option if you have gone through this program and you have found that the PCS part is a little confusing to you. That is just another option. So that is where I'm going to leave that because I'm going a little long. But again, I will leave this, all this information in the description box below. When you're choosing to decide on which program to go through, make sure you ask plenty of questions. If you want to go through the Ahima program, that is totally fine. I do recommend it. If you want to do independent study, there is the list of all the books that I recommend and the structure of how you should be able to study. And you can use that to augment your studies, or you can use that as your sole way to study for these exams. Whatever way you want to do it is entirely up to you. The information is there. So I'm going to wrap this one up. If this was helpful for you, I hope you give this a like. Subscribe if you haven't already. Share this if it helped you, and I will see you guys next time. Bye.